Want to know the most important question that moms can ask? Is this safe for me and my baby? As parents, our children are the center of our world, and the love that we feel for them is truly unmatched when they're born. However, parenting also comes with worrying about their health, development, and their future well-being every single step of the way. So today, we're going to talk about the effects that Tylenol has on our children. Maybe you're pregnant, you have a newborn, or maybe your baby's already a few years old. If at any point during your pregnancy, you're considering the popular medication Tylenol for pain, fever, or just any discomfort that arises, then this video is specifically for you. And here's why. Over the past decade, there's been several major studies that have surfaced showing that prenatal acetaminophen exposure correlates to an increased risk of neurodevelopmental disorders, things like autism and ADHD later on in childhood. I know, scary to hear, right? But here's the good news. This video will explore what the emerging research on Tylenol and autism currently shows, where the scientific debate still lies, and most importantly, how you, as an expectant or new mom, can make fully informed choices about medication safety during pregnancy moving forward. Knowledge is power, and our goal today is not to shame you, but to empower you. We're going to explore the latest research on links between prenatal acetaminophen exposure and that risk of autism spectrum disorder, the current scientific uncertainties around the subject, and any guidance on wise medication use during pregnancy. And this was exactly Beth's story. She was pregnant with her first child while working a full-time desk job and had a history of headaches and migraines. To keep going throughout the day, she utilized over-the-counter meds such as Tylenol. But after searching and reading some articles online and spending time visiting with the moms group, she started to nervously ask questions like, is this actually safe? And then what are some other natural options that don't come with risks? After a few friends mentioned neurologically focused chiropractic care, she thankfully ended up in our office. So here's what's going on. While there is still debate regarding causation versus correlation linking acetaminophen use and ASD, let's walk through what multiple major studies have reported. In short, significant epidemiological research has found an association between prenatal acetaminophen exposure and autism spectrum disorder. For example, a major study that was just published in 2020 measured some biomarkers in almost 1,000 different umbilical cord blood samples, and it found that over 3 times higher autism rates existed in babies exposed to acetaminophen in utero versus the least acetaminophen in utero. Other studies have found this correlation as well. For instance, there was another study that examined over 70,000 mothers, and it found a 20% increased risk of borderline or clinical neurodevelopmental issues like autism spectrum disorder and ADHD among these acetaminophen-exposed kids. Some argue that these observational findings do not yet prove cause and effect due to some method limitations of the studies. For example, these were retrospective studies, and they relied on mothers to self-report medication use months to years later, which that can risk inaccurate reporting. Some of the other analyses accounted for psychiatric history within a family, which seemed to also eliminate or weaken that connection, suggesting that it could also stem from shared genetics more so than just the medication itself. Overall, though, most of the experts have been calling for urgent additional investigation, given the big public health implications if this is a true autism link. Several medical groups now advise closer analysis of acetaminophen safety data and guidelines for pregnant women, given the accumulating evidence of some harm in here. So guidance for expectant mothers still remains to first try non-drug approaches like chiropractic care for pain relief and only utilize Tylenol when clearly medically necessary. Second, discuss your personal risk tolerance with your OB and consider some alternative options if you feel uneasy about medication side effects during pregnancy. And third, if you're using it, ingest the lowest effective dose for the shortest duration possible to avoid prolonged high quantity intake. Bottom line is, while you're avoiding acetaminophen entirely during pregnancy may seem unnecessary for most, carefully weighing those uncertain risks versus the benefits is a wise thing to do. And if additional research ultimately proves that prenatal acetaminophen use heightens the odds of neurological disorders like ASD, it would fit with the larger paradigm shift that's happening in medicine. We now understand autism's causes extend far beyond genetics alone. Instead, there's the complex interplay between prenatal stressors, birth trauma, your child's gut health, their medication use or toxin exposure, infections, and more that all create a perfect storm, disrupting all of those early developmental processes. And these intriguing connections between popular medications like acetaminophen and infant brain development represent one potential piece of autism's intricate puzzle. This isn't good news, but what is great is that all of this emerging knowledge is empowering mothers to become informed consumers regarding medication choices that could end up impacting their children for life. And for families already on that autism journey, take heart. With a greater understanding of ASD's neurological components comes advanced interventions like neurologically focused chiropractic care that can truly target root causes, not just suppress their symptoms. So whether you are pregnant or you've had your sweet babies already, safeguarding their future means supporting all women in making educated decisions about pregnancy interventions. From fertility to birth and beyond, our children's well-being first depends on empowering the mothers with information and with choices. To learn more about drug-free support options for healthy pregnancy and baby development, check us out here at Foundations Chiropractic. Click the link in our bio to read more on the research of Tylenol and ASD.